Okay, nerve physiology. First thing first, talk about the cells which make up the nervous system. Glial cells, neurons. Glial cells are going to be divided into microglia, which are the macrophages which are in the central nervous system, and the macroglia. Macro will be divided into astrocytes, oligodendrocytes, Schwann cells. The oligodendrocytes will marinate in the central nervous system, Schwann cells in the peripheral nervous system. Astrocytes will form the blood-brain barrier, and we have got the fibrous ones and the protoplasmic ones. Okay, so we've talked about this already. And then a neuron itself, which is the structural and functional unit of the nervous system, this one is going to be different from other cells. Neurons are branched, have nuclear granules. They have got no, this is important, no centrosome. Because of the absence of centrosome, they have got no power of division. Okay, they also contain neurotransmitters. You can see there the parts of a neuron. Now, these neurons can be myelinated. Myelin forms when a Schwann cell wraps around an axon up to 100 times. And because we're talking about a Schwann cell, that should be obviously in the peripheral nervous system, while in the central nervous system, oligodendrocytes. Now, for the fact that some cells are myelinated, others are non-myelinated, doesn't mean that they do not have Schwann cells. Some cells do not are not myelinated, but they have got Schwann cells. The Schwann cells simply wrap around them. Okay, and but even if they are wrapping around them, they have not really wrapped to form that myelination we are saying. So not all mammalian neurons are myelinated. Some are unmyelinated. That is simply surrounded by Schwann cells. So meaning all cells, all nerves are going to be surrounded by Schwann cells without wrapping of the Schwann cells around them. Then we are going to be able to say if axons are not wrapped around, then we are going to say that they are unmyelinated, but the Schwann cells are already there. That's how myelination will be able to happen, leaving the nucleus of the Schwann cell on the periphery like that. How do you classify neurons? You can classify them as depending on the number of poles as unipolar, bipolar, multipolar, pseudo-unipolar, depending on upon the length of the axon. You can say they are myelinated or non-myelinated. That is basically actually the structure, myelinated or non-myelinated. Also, depending upon the distribution, they can be somatic, meaning they are going to skeletal muscle, or viscera, supplying internal organs. You can also classify them upon origin, like cranial nerves or spinal nerves. You can also classify them depending on the secretion of neurotransmitter. Others do secrete adrenergic nerves, neurotransmitters, others cholinergic. You can also classify nerves depending on the diameter and conduction. So I'm only mentioning things which I'm interested in because that's what I've seen from many papers. Depending upon the diameter and conduction of impulse. That's also known as the Elninger-Gasser classification. So when you're classifying depending on the diameter and conduction, you have got the type A fibers, the type B fibers, and the type C fibers. The type A, these are the thickest, the type C are the thinnest. Now, the type A can be divided into A alpha, A beta, A gamma, and A delta. A alpha is also known as type 1, A beta type 2, A gamma type 3. And if you remember this table in test 1 last year, okay, so type 1 fibers are myelinated all the way up to type 1, all the type 1s, I mean all the type A's are myelinated, type A alpha, A beta, A gamma, A delta, and also type B, meaning because they are myelinated, their conduction is going to be much faster. while the type C fibers are unmyelinated, and so we expect their conduction to be a bit slower, right? So now let's look at these questions. You can be free to open your mic and then answer them. Which is not a central nervous system glial cell? Schwann cell, microglial, astrocyte, oligodendroglial. Which one can you pick? Which is not a central nervous system glial cell? Yes, A. So all the other glial cells you can see are in the central nervous system. Astrocytes forming the blood-brain barrier, oligodendrocytes forming the myelination, microglia, which are basically the tissue macrophages there. You also have ependymal cells, which will form a colloid plexus, which does produce the cerebrospinal fluid. The most susceptible nerve fiber to local anesthetics: C-type fiber, B-type parasympathetic fiber, and then type A. Which one would you pick? Which one would you go for? Okay, so we want nerve fibers which will be able to respond more to anesthetics. You want something that should be able to conduct faster. So which one of those conducts very fast? Type A. The conduction velocity is a myelinated. The conduction velocity in a myelinated fiber is directly related to the amount of axon branching, length of the fiber, diameter of the fiber, diameter of the dendrocytes. Which one would you pick here? Conduction velocity in a myelinated fiber. Related direct to what? Yes, the diameter of the fiber or the axon, right? Non-myelinated fiber differ from myelinated ones in that they lack nodes of Ranvier, are most excitable, have higher conduction velocity, are not associated with Schwann cells. Which one do you think is the answer there? Which one? They lack of nodes of Ranvier. Okay, let's start. Non-myelinated fibers differ from myelinated. Non-myelinated in that are more excitable, and non-myelinated more excitable is supposed to be the opposite. Have higher conduction, supposed to be opposite. Are not associated with Schwann cells. They are, that's not true, of course. So lack nodes of Ranvier because they don't have these myelin sheaths forming, right? So there are no those nodes of Ranvier or those spaces between the nerves. Not true of an astrocyte, found throughout the brain, joined to the blood vessels, help forming blood-brain barrier, form myelin around the axon within central nervous system, help in maintaining optimal concentration of ions in the brain. Which one is not true? Which one is not true? Yes, form myelin around the axon. That's not a function of astrocytes. All right. Okay, so we continue. Those are just some trial questions. When a membrane is permeable to several ions, the membrane is permeable to several ions. The diffusion potential that develops depends on three factors. Now, the thing is this: the cell membrane will be able to allow different ions to be able to pass through it. Now, what determines how fast those ions will be able to pass through the cell membrane. One thing is going to be the polarity of the electrical charge of each ion. Other ions can pass through the cell membrane just because of their charge, others will not be able to pass through the cell membrane because of their charge. And then also the permeability, others are actually more permeable to the cell membrane is more permeable to them than others. For example, potassium and sodium. The cell membrane is more permeable to potassium than it is to sodium. And also the concentration of the respective ion on the inside and outside of the cell. So the difference in concentrations inside the cell and outside the cell also determine how much uh, the permeability of the cell membrane is going to be to that ion. So we can calculate the membrane potential of the cell membrane. Membrane potential is just referring to the potential difference inside the cell and outside the cell. Membrane potential is 61 log the permeability of ions outside the cell multiplied by their concentrations. You add them and then you divide by the permeability inside the cell. You multiply by their concentrations, just like that. And the major contributors to resting membrane potential, you can see we have got the potassium and the sodium here. Okay. So at normal uh, what do I at normal environment, internal environment, when you are actually resting, there's nothing that is going on. Normally the inside of the cell is supposed to be negative, the outside of the cell is supposed to be positive. Okay. So you can look at some values of membrane potentials of sodium, potassium, chloride. You can see sodium is positive 60, potassium negative 90, chloride negative 70. Look at the nerve. Nerve is negative 70. So the cell potential, the membrane potential of potassium is more close to the membrane potential of a nerve. That is why nerves are going to be more allowing potassium to pass through them than sodium, because sodium's membrane potential is very much away from that of the nerve. So when there is, because the membrane potential of potassium negative 90 is close to that of the nerve negative 70, means that potassium is more likely to pass through the cell membrane than sodium, because you can see the sodium's membrane potential is positive 60. So the cell membrane is more permeable to potassium than it is to sodium. Okay. So the sodium potassium pump is going to be able to contribute indirectly to the resting membrane potential. And how it does that is basically by maintaining across the cell membrane the sodium and potassium concentration gradient. So if the concentration gradient of the sodium and the potassium is going to change, what is going to happen? Remember, between where is sodium supposed to be more? Is it inside the cell or outside the cell? Sodium. Where is it supposed to be more? Sodium is supposed to be more outside the cell. What is more inside the same cell are the P's. Proteins, potassium, phosphates, those are more inside the cell. So what happens at normal at no, normal environment, in case there is a fluctuation, there is a change in the concentration of sodium and potassium, the sodium potassium pump will be used, where three sodiums pumped out of the cell and then two potassiums pumped into the cell. So action potential is going to occur when the resting membrane potential of a cell rapidly rises and falls. So there is a rise, there is a fall, there is a rise, there is a fall. That will cause an action potential. Now, what are some of the types of ion channels in the cell membrane that will allow ions to be able to pass through them, because if ions are allowed to pass through them, that is going to affect also the membrane potential of the cell and also conduction of that cell. So the first one, we have got the voltage gated ion channels. From the word voltage gated, these channels are going to open when there is a change in voltage, right? Like they are voltage gated channels. So they are going to open when there is a change in membrane potential. Okay. And then the ligand gated channels, these ones open when a ligand binds. A ligand is, we're basically talking about hormones. Mechanically gated ion channels, these ones open when there is a mechanical stress to the cell. For example, there is a touch, okay, something like that. There is acid. There are also thermally gated ion channels. These ones will open in response to temperature. Now, how is an action potential generated? A change in membrane potential during an action potential is due to an increased permeability of the cell membrane to sodium. The cell membrane normally is not more permeable to sodium, but when there's an increase in permeability to sodium, that is going to be able to change the membrane potential, resulting into an action potential. So first, there's going to be a temporal increase in sodium permeability in the cell membrane. That is going to be due to the opening of sodium channels, and that will cause depolarization of the cell membrane. Depolarization of the cell membrane, meaning the cell membrane is becoming, it's when something is depolarizing, you are reducing the charge. It was more negative, let me say, increasing the charge. It was more negative, is becoming more positive. Remember the sodium here, sodium is positive. Okay, I'm going to show you another diagram there. Sodium permeability, when sodium starts to pass through the cell membrane, it will not continue to pass through the cell membrane like that, because its permeability to the cell membrane is short-lived. So what is going to happen is that the membrane will become again more permeable to potassium, even more permeable than it was at rest to potassium. Already it is permeable to potassium, but first at the beginning the cell membrane became permeable to sodium, and then when sodium started entering, it made it to become more permeable to potassium. But because the cell membrane will be just short-lived permeability to sodium, that is going to be known as undershoot or after hyperpolarization. The sodium channels that open when an action potential is generated are known as the voltage gated channels. They are going to open due to voltage. An action potential is generated for because of the voltage, and that opens the sodium channels. When the sodium channels are opened, then the sodium begins to flow in. And then what happens later is when the threshold is reached, action potential is going to be generated. Initially, when the sodium was actually entering the cell, there was no action potential. Now, look, sodium is positively charged, right? And we said that at normal environment, the inside of the cell is supposed to be negative. So the entry of positive into the cell is reducing the negativity of the cell. So the cell is becoming positive, and that is what is causing a decrease, that decrease or depolarization, because the cell was negative. You are depolarizing it, you are making it positive. Action potential is only going to be generated as a all or none response. You should reach a minimum. If you don't reach a minimum, we are not going to fire. If you reach a minimum, then we are going to be able to fire. Okay. Okay, look at this. So ions are able to flow from one end of the cell to the other end of the cell just like that. The concentration of those ions or those particles which are osmotically active is known as an osmo. Osmotically active means that those particles can actually move to dilute water. Those are what we call osmotically active particles. And their concentration and in osmose is given by molarity multiplied by n. This n is just representing the ionization of that compound. For example, sodium chloride. If sodium chloride disassociates to form one sodium ion and one chloride ion, so there are two, so that n will be 2. If you multiply that 2 with the concentration here, molarity is going to give you osmolarity. Okay. Osmolarity is the number of osmoles per liter of solution. Osmo per liter of solution. Remember, osmo is just a concentration of osmotically active particles. And then osmolarity, on the other hand, is the number of osmoles per kg of solvent. So we are dividing mole over liter or mole over kg. That just determines if it's osmo or osmolarity or osmolarity. Also need to take note of this formula. Osmolarity in milliosmoles per liter is going to be given by freezing point depletion over 0.0186. At least just know it. Freezing point depletion. So if you've been given the freezing point depletion, they can ask you to find the osmolarity, and the answer will always be in milliosmoles per liter. So divide by 0.00186. Also take note, you can also calculate osmolarity using this formula: 2 times sodium ions plus glucose over 18 plus blood urea nitrogen over 2.8. You also have something which is known as tonicity. Now, tonicity is just the ability of a combined effect of solid to generate an osmotic driving force. Okay. So tonicity. Tonicity is different from osmolarity. Remember, osmolarity is just a concentration. Now, tonicity is a combined effect of solid to generate an osmotic driving force that causes water movement. Let's say, for example, you have got sugar. You have got sugar which is more concentrated. What will happen is that if you put a membrane between that solution that has got a lot of sugar and just pure water, water will start moving to that direction. So there is tonicity because that compound has got an ability to pull water towards itself. So only the compounds which have got tonicity only includes things like sodium, chlorine. Urea does not have any tonicity. Of course, urea will contribute to the concentration of the solution. Concentration is just talking about the number of particles in a solution, right, divided by the volume or the kg of that solution. But tonicity is this molecule able to pull water towards itself? Urea doesn't do that. So urea doesn't contribute to tonicity. Solutions that have the same osmolarity are said to be isotonic. Those with a greater osmolarity in comparison to, of course, the standard cell, they are hypertonic. Those with lower hypotonic. And let's just take note of this. Something to help you know this at least is P's are supposed to be inside the cell. More P's inside the cell. Potassium, phosphates, proteins are more inside the cell. Okay, can see, look at the concentration of potassium inside the cell, 140, and then proteins inside the cell. Where is the protein here? 16, and then also the phosphates. We can also see even the partial pressure of carbon dioxide is more inside the cell. Phosphates there. Phosphate is also inside the cell more, 75. Now, potassium and sodium are always opposite of each other because they are both positive. So the potassium is going to more like repel sodium. Sodium is more outside the cell, 142. Where sodium is high, that is where I expect chlorine to be high. Because sodium is high outside the cell, chlorine should be high outside the cell, 103. And then the calcium is more going to be also outside the cell. Think of it, you calcium is important in muscle contraction, right? So it needs to go into the cell and then generate an action potential like that. So it's more outside the cell. Magnesium more inside the cell. Nothing we need to understand is about diffusion. Diffusion, we already know what the definition for diffusion is: the movement of particles from high concentration to low concentration. What I just want to concentrate here is Fick's law. Fick's law of diffusion tells us that the magnitude of diffusion tendency from one region to another is direct proportion to the cross-sectional area, meaning that when you have got a big surface area, okay, a big surface area, think of a big door. A lot of people can pass in a big door than a small door. So the bigger the surface area, the higher the rate of diffusion. And then also the concentration difference. The higher the concentration difference, let's say on one end you have got 2 moles, the other end you have got 20 moles. There is a concentration difference here, so molecules can be able to flow. But if you have got 2 moles this side and only 1 mole this side, the concentration, the rate of diffusion will be a bit small or slow. Okay, and then the rate of diffusion will be inversely proportion to the thickness. So if you are talking about the boundary, your boundary, or your the thing that where you are passing, the molecules are passing, if it is very thick, there's going to be obstruction, so the rate of diffusion is going to be decreased. So what factors increase the rate of diffusion? Surface area and the concentration. And then those which reduce is the thickness. The bigger the thickness, the smaller the rate of diffusion. You also have what is known as the Donan effect. Think of it, the inside of the cell, we said that it has got more of the P's, protons. I mean, proteins are high inside the cell. So what happens that the proteins are going to be pushing away things which are negative. That's why you see chlorine is more outside the cell than inside the cell. Why? Because chlorine is being pushed away by the proteins inside, because they're also negatively charged. And then the chlorine will start now pulling towards itself those things which are positive. That's why the chlorine starts pulling towards itself the sodium. The proteins inside the cell also is pulling those things which are positively charged, like the potassium. And you know that the cell membrane is more permeable to potassium, so the potassium is pulled more to the inside of the cell. That's why they are also high inside the cell. That's the Donan effect. So how will ions be able to move to be able to cause an action potential? The cell membrane of nerves, like those of other cells, will contain many different types of ion channels, as we've described. Ion gated, you have got all these ligand gated. Some of these are voltage and others are ligand. Okay. It is the behavior of these channels, and particularly the sodium and potassium channels, which explain the electrical event in nerves. In response to a depolarizing stimulus, any stimulus that can depolarize a cell, some of the voltage sodium channels are going to become active. And when they become active, the threshold potential is going to be reached by sodium entering the cell. Sodium enters the cell, it enters the cell, the threshold is going to be reached. The voltage gated sodium channels are going to be able to overwhelm the potassium and other channels, and an action potential is going to be able to result. And that is a positive feedback, because the entry of one encourages the entry of others. The membrane potential is going to move toward the equilibrium potential of sodium, which is positive 60. That is why when sodium is entering and entering and entering, the membrane potential will be reducing all the way from negative 70, which is the membrane potential of the cell membrane, and increasing like that. So you can see what is happening. So the membrane potential was negative 70. The sodium gated channels were open. Sodium started entering. When we reach the threshold, which is negative 55, more sodium channels open, sodium floods. Okay, they are going to open, and then sodium is going to flood in. And you can see we want to go towards the membrane potential of sodium, which is around 60, 65, but will not reach there. We'll just reach at negative 35, and then there's going to be a repolarization. The sodium channels are going to rapidly enter a closed state called the inactivated state. Now, when the sodium has entered the cell, they are normally not closed. Okay, they'll just be inactivated. So the reason as to why the membrane potential is repolarizing, not because they've closed, but they've been inactivated. And then what is happening is that other things are getting to. So what can cause repolarization is either negative charge entering the cell or positive charge leaving. So the potassium can be leaving the cell. That means that if positive charge is leaving, the cell will be remaining negative. That's causing the repolarization. And so you can see what was happening here. At the top, the sodium channels are going to be able to close, and then the potassium channels are going to be able to open. Potassium starts to move outside the cell, and repolarization happens. But repolarization, as it is happening, there'll be a point when you actually exceed your membrane potential for the nerve, that is hyperpolarization, and that is going to be restored. That will be by active pumping of sodium out and potassium in. Okay, sodium out and potassium in. So what will be the effect of different ions on the resting membrane potential? Decreasing the external sodium concentration. If the concentration of sodium outside the cell has been decreased, that has little effect on resting membrane potential, but it's going to reduce the size of the action potential. The size of the action potential is going to be reduced. Remember, the when you are finding the resting membrane potential, sodium is one of that in the equation, but it rarely affects resting membrane potential. But it is going to be able to reduce the size of the action potential. Action potential, you want something to be able to shoot like that. You want the nerve to be able to shoot so that you can feel whatsoever the pain or something like that. So when you have got hyperkalemia, you have got a lot of sodium, the neurons are going to become more excitable. And maybe the question should be, why should they become more excitable? If you use the same equation for resting membrane potential to calculate the resting membrane potential after you increase the concentration of sodium in this case. Okay, this is hyperkalemia, so not hypernatremia. So this is potassium, not sodium. When you increase the concentration of potassium outside the cell, what is going to happen is when you put in that formula 61 log of permeability concentration outside over inside, so the cell is becoming more excitable. You can actually try that where you are when you are free, just to see what will happen. Okay, imagine the concentration of potassium outside the cell was, let's say, a 5, and then it was increased to 10. What is going to happen to the membrane potential? So it makes the cell to become more excitable, and the reason for that is because the cell's uh, membrane potential is drawing closer to the threshold. When it is close to the threshold, it becomes more excitable. How about hypokalemia? The neurons will become hyperpolarized. The reason for that is we are moving, remember, it's just the opposite. If hyperkalemia is drawing the resting membrane potential towards the threshold, it means that hypokalemia should draw it away from the threshold. That is becoming hyperpolarized or becoming more negative. And then hypocalcemia is going to increase excitability. When you have got low calcium outside the cell, it increases excitability. And then hypercalcemia, this one is going to decrease excitability. So the more the calcium outside the cell, the less excitable the cell is. Okay. But think of it like calcium, of course, is also needed in the contraction of muscles. But think of it, imagine of it in this way. You already have the calcium, which is a lot around. So even if more enters, like you already used, okay, we know of this desensitization or habituation. So the calcium is already there. But take note of sodium. Sodium has little effect on the resting membrane potential. Okay, so now let's talk about this. Properties of an action potential. The only property that I want to talk about is fibers with large diameters. Fibers with large diameters are going to conduct faster than those with small diameters, and that is going to be given by the rule down here. Velocity is equal to diameter of myelinated fiber times 4.5 in meters per second. While velocity is also going to be given by square root of unmyelinated fibers diameter in meters per second. So the question is, which one is faster between myelinated and unmyelinated? You can see for the unmyelinated, you are finding the square root of the diameter. So that reduces the number. But for the myelinated, you're actually getting the diameter and multiplying it by 4.5. So it is much quick. How about axonal transport? Neurons are secretory cells. They can secrete things, but they do differ from other secretory cells in that the secretory zone is at the end of the axon. So at the end of the axon, that's where you are going to be able to secrete things on the terminal, okay, far from the body. The apparatus for protein synthesis is located for the most part in the cell body. What will be making proteins is in the cell body, and then transport of proteins and polypeptides to the axon ending is going to be by axoplasmic flow. Axoplasmic flow. That the cell body is going to maintain the function and anatomic integrity of the axon. If the axon is cut, the part distal to the cut is going to be able to degenerate by the Wallerian degeneration. So the transport of things can happen by one, the orthograde transport, and the orthograde transport is where things are transported from the body to the terminus. You can see there is a transport of proteins which have been made from the body here to the terminus there. And then you also have the retrograde transport where you have got things which are in the terminus being transported to the axon. So the orthograde transport, you are going to have different components. We are going to have the first axonal transport. The first axonal transport is going to occur at about 400 millimeters per day, while the slow axonal transport is going to occur around zero point 0.5 to 10 millimeters per day. Retrograde transport is the transport that works in the opposite direction. We already talked about that. Excitation and conduction. Nerve cells have a low threshold for excitation. That's around the negative 55. The stimulus may be electrical, chemical, or mechanical. Two types of physiochemical disturbances are produced: local, non-propagated potentials called you have got local non-propagated potentials. A potential that is not propagated means that there is of course a potential that has happened. There's a change in the membrane potential, but then that change in the membrane potential was not enough to cause an action potential to be able to cause an action in a nerve. So these we are talking about, these are only electrical responses of neurons and other excitable tissue, and they are the many language of the nervous system. These nervous impulses or action potentials which will be generated. Now look at this. A synapse is very important when it comes to nerves, and there are different types of synapses. The cell body of one nerve can actually synapse with the dendrites of another nerve, or the cell body of one nerve can synapse. Synapse is more like to meet or join with the cell body of another nerve. So that will be axonal, axodendritic, and all those. A nerve in the brain may have up to 10 million or 10,000 to 150,000 synapses joining with others. Disorders of synaptic transmission. Synaptic transmission is the most vulnerable step. Synaptic transmission, we're talking about just at a synapse where the cell body of one nerve is joining with, let's say, the cell body or the dendrites of another nerve. There is a transport of neurotransmitters at that moment. What will happen is that neurotransmitter can move from the dendrites from one nerve or the cell bodies of one nerve going into the other one. So at that point, there are a lot of things that can go wrong. Most of the nervous disorders, such as Parkinson's disease, all those are going to happen because there is a problem on synaptic transmission. Caffeine, nicotine, alcohol, and common drugs also affect synaptic transmission. Myasthenia gravis, this one you are going to have an autosomal disease. the body is going to fail to recognize acetylcholine. Acetylcholine is one of the neurotransmitters, one of those things which will be transmitted or to be passed on the synapse. Remember, proteins are synthesized and then they can be transported from the cell body to the dendrites and then they can move like that. Neurotransmitter acetylcholine, sometimes the body cannot recognize it. So the body, normally what is supposed to happen is that when the acetylcholine moves from the end, the nerve terminus, to go into a muscle, there are receptors on a muscle that are supposed to trap this acetylcholine. But the body, because it doesn't recognize these acetylcholine receptors, the receptors are going to be destroyed by antibodies which the body is going to make. And because of that, that is going to cause the membrane to withdraw the receptors from the surface and destroy them inside. So there's not going to be any receptor on the surface. Such that even when neurotransmitter acetylcholine has been produced by the nerve, if it goes, it wants to attach on the muscle. There are no receptors to attach there. So the destruction of the receptor is going to produce a diminished excitatory response to acetylcholine. So there's going to be inability of the muscles to be able to contract because there's no acetylcholine. So this is what we can see here. This is at the end. You have got the acetylcholines. You can see they are actually in vesicles. When they are produced, they're supposed to go and first pass in the synaptic cleft. Because of this space, there's going to be a delay of around 0.5 seconds when there's an action potential being generated. And then these acetylcholine are supposed to attach to their receptors on the post-synaptic membrane. This one, this membrane we can see is known as a presynaptic because it's before a synapse, before this joining. And then the muscle is mostly going to be a postsynaptic. Okay. You have got different types of neurotransmitters. You have got those which are made from amino acids, from purines, from different things. So amino acids and purine transmitters are going to be made in the axon terminus. And those are going to be enzymes needed for their synthesis to be able to happen. And then for the polypeptides, neurotransmitters, polypeptides, these ones are going to be made in the cell body other than the amino acids, amines, and purines which are made in the terminus. You also have gaseous neurotransmitters, for example, nitrogen oxide, which is synthesized from oxygen and amino acid arginine. But these ones are not stored in vesicles like the acetylcholine. These are going to be able to diffuse into its target cell rather than a membrane, and they are going to bind to their receptors and proteins to like nucleic acids. So what is the half-life for these guys is around 2 to 30 seconds. Nitrogen monoxide is synthesized in the endothelial cells lining blood vessels. And this one is used for relaxation, nitrogen oxide, relaxation. And then when you talk about acetylcholine itself, acetylcholine is going to be synthesized by acetylcholine transferase. Okay. Synthesis is going to require the enzyme choline acetyltransferase. When the acetylcholine has been made, it is made, of course, from choline and from the coenzyme A. When it has been made, it can be transported in a synaptic vesicle to go to its receptors on the postsynaptic cell. And then if it does its work there, because immediately it attaches on its receptor, there's going to be a potential that is going to be generated on this cell. And then now the acetylcholine can be broken down by acetylcholine estrase. And then you're going to form choline and acetate. The choline will go back into the cell and be used again to be able to form acetylcholine. Calcium is also going to be a trigger of the release of the neurotransmitter acetylcholine. So if calcium is there, it can cause the release of acetylcholine. Okay, so you can you can get, there can be a blockade on the acetylchol acetylcholine release. So I've got the enzyme, the medicine which is known as curare. I don't know if you can read that. Okay, this one is going to block channel opening and propagation of action potential. So because it does that, it is going to be used as a muscle relaxant, because muscles will not be able to contract if there is no action potential. And then you have other things which inhibit the breakdown of acetylcholine. You know what breaks down acetylcholine is acetylcholine estrase. So you have got anti-choline estrase, meaning these are ones which are fighting the breakdown of acetylcholine. These ones are going to slow down the action, the breaking down of acetylcholine in the synaptic cleft. And that is going to allow acetylcholine to remain active at the motor end plate for long. And that is how nerve gases and pesticides are going to be able to work. So they are going to be used to treat patients with myasthenia gravis. Remember, myasthenia gravis, the problem was we are destroying acetyl choline receptors. Okay, so at least if you increase the amount of acetylcholine in the clays, there can be a chance of a generation of an action potential and a strong contraction, other than when there is none. Okay, now let's go on and look at some of these questions from papers. Starting with this one. Okay, this one I'm going to pass it. Then this one, then this one. Let's go to this one. Hope we do have a calculator somewhere near so that we can be able to find. Freezing point of normal human blood is, and this one is, these are all from exam papers. Freezing point of normal human blood is negative 0.54 degrees Celsius, which corresponds to an osmolar plasma concentration of, what will be the osmolar plasma concentration? Now, anyone who can help, what are we going to, how can we answer this question from what we've discussed? Be free to speak. I believe in people speaking because trust me, it will really help you. Other than you just hearing someone speaking or not even write the exam. How can we calculate the osmolar plasma concentration here? Okay, so we said the concentration, osmolar plasma concentration, is given by freezing point depression. Okay, freezing point depression divided by 0.00186. So this is going to be the freezing point depression. Just the word depression means that there is a decrease. This negative sign is just showing that that is a depression, so there's no need of putting that negative. 0.54 divided by 0.00186. If you have a calculator, you can help with the punching there. So this is giving me a 290. Now we say that this answer should always be in milliosmoles when you use this equation, milliosmoles per liter. So the answer is going to be this one. Okay, let's go to this one. Please be answering so that we discuss this. The osmolarity of fluid. A, ICF is hypertonic to plasma. B. Sodium exerts approximately 80% of plasma osmolarity. C. Plasma proteins exert approximately 10% of the plasma osmolarity. The osmolarity is affected by the volume of solutes and temperature. Which one would you pick for this one? Said B or D? D. Okay. Your mic is not that clear. Believe that's B. Anyone else uh, going for a different answer? D. Okay. Anyone else? No other option. Osmolarity of fluids. D. The osmolarity is affected by volume and of solutes and temperature. Okay. So if you look at osmolarity, ICF is hypertonic to plasma. Normally, the concentration of what is in the concentration of ICF is equal to the concentration of ACF, normally 300. But the major contributor to plasma osmolarity is sodium. That's a major contributor to plasma osmolarity. So B can be one of those answers which qualify. Sodium exerts approximately 80%. If you look at D, the osmolarity is affected by the volume of solutes and temperature. Why did you choose this one? Let me maybe ask in case someone has analyzed it. Why did you choose this one? So osmolarity, you are just talking about the number of osmoles or the number of particles which are in a solution. So really temperature shouldn't affect that. Okay. Just the number of particles which are in a solution. So the best there we can pick is a B. The osmolarity of plasma A is almost all due to plasma sodium, is chiefly due to plasma albumin, is the same as that of ICF, increases significantly in dehydration, in vomiting. Which one can we pick here? Osmolarity of plasma, almost all due to plasma sodium, chiefly due to plasma albumin, it's the same as that of ICF, increases significantly in dehydration, in vomiting. I want to hear from us. B or D? D. D. Okay, increasing significantly in dehydration. Why do you choose that one? Nice one. Any other answer, docs? Okay. So for A is almost all due to plasma sodium. Of course, sodium is a major contributor, but not almost all. It's chiefly due to plasma albumin, not really. It's the same as that of ICF. The values are more close to each other, but they are not really the same. You find that this one is 300. The other one is slightly lower. They are slightly lower because of the difference of ion concentrations inside the cell and outside the cell. So the answer that the doc has given makes sense. Okay, so we have got one. Yes, yes, please. Is the same as that of ICF. So the plasma, the concentration plasma. Remember, plasma is ECF, right? Plasma is ECF. The concentration or the osmolarity of the inside of the cell normally is supposed to be the same as that of outside the cell, but significantly there is a little difference when you do calculate the osmolarity of the inside of the cell and of the outside of the cell. Like that should be like one is a 300, the other one should be like a 397. So there's a bit of a difference there on the osmolarity. I don't know if that's okay. Yes. According to Fick's law of diffusion, particle flux will decrease if there is an increase in temperature of solutions, diameter of the particles, area of the membrane, thickness of the membrane. Which one would you pick here? According to Fick's law, diffusion particle flux will decrease if there is what? Remember we gave the equation for Fick's law, the rate of diffusion according to Fick's law. No one remembers the equation, or no one has an idea on this one. We said the rate of diffusion is direct proportional to the cross-sectional area and the concentration difference, and inversely proportional to the thickness. So according to Fick's law, particle flux will decrease. We want something that will decrease the rate. So what should decrease the rate is the increase in the thickness. Do you have such an answer? Thickness of the membrane? Yes. The area of the membrane does not decrease. Diameter of the particle, of course the diameter of the particle can decrease the rate, but that's not part of Fick's law. Temperature is not part of Fick's law. Okay. Which of the following has higher osmolarity? To calculate which one has higher osmolarity, just look at the concentration. Osmolarity is, they've already given us the osmolarity is zero point 0.2 molar sodium chloride, 0.3, 0.1, 0.4. You can see what has got the higher one. The numbers are showing. The osmolarity of a solution, and these questions are from exam papers. Huh? The osmolarity, which one is a bigger number here? Look at it. Which concentration is big? No answer. Pardon? 0.4. Osmolarity of a solution is measured in molarity, millimolarity, osmos, milliosmos. Which one do you pick? Which one? Yes. Maybe or smoke. Very good. So you want to measure the concentration in small units like that because the body doesn't have big concentrations. It's not that highly concentrated. So that's why milliosmol becomes the most convenient unit. Which of the following statements about tonicity is true? Tonicity refers to the total solute concentration in a solution. Hypertonic solution cause cells to shrink. Hypotonic solution cause cells to swell, all of the above. Which one can we pick? Any idea? Yes. Now I can easily be saying the answers and then we move on. So that's why I started with a topic overview so that it will be easier for us to answer. Otherwise, I could have just gone direct to the questions and started answering. That's not hard. But I think that's what has been not helping the entire academic year. That's why we are trying to use this way. Mhm. Hypotonic solutions cause cells to swell. You said C, right? If a cell is hypotonic, it means that its concentration is small. Yes, it will cause the cells to swell. And definitely, for hypertonic, it should cause the cell to shrink. So if C is the as an answer, definitely it means that B is also an answer. So the answer is all of the above. The movement of water between the intracellular and extracellular compartments is primarily regulated by osmosis, active transport, diffusion, filtration. Which one can we pick here? Osmosis. Which of the following is a major cation in the extracellular fluid? Major cation in ICF. Intracellular fluid, sorry, not extracellular, intracellular fluid. Potassium. Remember the P's. The primary osmotically active particle in the extracellular fluid is which one can we go for? Sodium, yes. Okay, we have got this table here. Now, first, before even answer this question, one thing you need to know about diffusion is diffusion is direct proportional to the amount of compounds. So when you're using a graph, diffusion will be represented by a straight line. Now, when you have got, there's also carrier facilitated diffusion. You have a carrier, the only way you can pass through the cell membrane is if this carrier is there to carry that compound. Meaning that if all the channels or all the gates have been are having something to carry, even if you increase the concentration of what is supposed to be transported, it is going to do no good because there's no transporter. Okay, think of the glucose transporters. Even if you increase glucose, as long as you don't have enough glucose transporters, the rate of diffusion will stop to increase. It was increasing, it stops increasing. That is carrier or carrier facilitated, okay, diffusion. The figure and the accompanying questions test your understanding of membrane transport. The graph simply represents extracellular concentration versus rate of transport. A. Which cave or caves could describe represent simple diffusion? Which one can we pick? Representing simple diffusion. Hope hope you can see the caves how they are looking. Which one can you pick? Yes? Okay, in case there is no idea, you can just say nothing so that we move. Okay, so simple diffusion here is going to be A. Said simple diffusion does not depend, there is no limitation. If you increase the amount of compounds to be transported, the rate will increase and there's no limit. There's no door whereby no, the door is now shut so this thing can't pass. Which cave or caves could represent protein mediated transport? So protein mediated transport is B, C, and D. Which cave has the lowest transport maximum? The lowest transport maximum you can see is the one at the bottom there. Maybe the question should be, what is transport maximum? Anyone who knows what transport maximum is? Pardon? Transport maximum is just a maximum rate at which a system is able to transport a solute. So you can see, hmm, okay. So transport max for part 2, give a reason for your answer. Which scale represent? The reason is because you can see that after a certain concentration, the rate of the reaction stopped increasing, and that might mean that all the protein transporters have got something to transport. So there is no more any space for further transporting other compounds. So the curve with the, okay, which curves demonstrate, which curve or curves demonstrate a transport maximum? Again, also this one, BCD is demonstrating that the one with the lowest transport maximum is D. You can see it is the one which has got the smallest rate, okay, after it has been filled up with things to transport. If C represents the movement of glucose into skeletal muscle under controlled conditions, which curve would represent glucose transport after adding additional insulin? What does insulin do to the number of functional transporters in the system? Now, what insulin does is that it will increase the number of glucose transporters. And because it does increase the number of glucose transporters, also the rate, the transport maximum is going to increase. So if C is representing the rate without insulin, then the one on top should represent the rate with insulin because you have increased more transporters. Predict a change in cell volume, increase, decrease, or no change when a normal red blood cell previously equilibrated in isotonic saline is placed in the following. If it is placed in 200 milliosmoles of sodium chloride, what do you think would be the answer? If it is placed in 200 milliosmoles of sodium chloride, Is it going to increase in volume, decrease, or there will be no change? Okay. So if you look at a red blood cell, which was previously equilibrated in acetonic saline, acetonic saline has got a concentration as the normal concentration of the body, which is 300. This concentration is below 300, meaning that water will move from this compound going to the cell. So the cell will end up increasing in volume. Now, if you look at B, what will happen if you place a cell in B? There's nothing that will happen to the cell because the osmolarity of the cell is 300 milliosmoles. Also, that concentration is 300 milliosmoles. How did I know? Remember what we said? Osmo is given by molarity times N. Sodium chloride, we said that N is going to be 2 because if it disassociates to give us a value of 2. Sodium 1 ion, chlorine 1 ion, that's 2. So 150 times 2, that is 300. And 300 is the same as the concentration of the cell equilibrated in isotonic saline. So there's going to be no change. And then for C, for B, if you remember, we had said that osmolarity is molarity times N. Do you remember that? Osmolarity was molarity times N, where N was representing a particles after dissociation of a compound. So sodium chloride, when it dissociated, forms two ions. So 150 times 2, that will give us 300 milliosmoles because it was in millimoles. In case of calcium chloride, CaCl2, N here will be equal to 3. This associates. So it will be 3 times 150. And then for C, 500 milliosmoles urea only. We said that urea doesn't affect tonicity. So even when you have got urea only, you don't affect particles to the movement of particles to be affected because urea does not affect tonicity, which is the movement of things. How about 200 milliosmoles of sodium chloride and 200 milliosmoles of glycerol, a slowly penetrating substance? So initially, you've also been told that it is glycerol is a slowly penetrating substance. Okay, is there anyone who wants to answer here? What will be the effect, the short-term effect and the long-term effect? So initially you have got 200 milliosmoles plus 200 milliosmoles. That is 400 milliosmoles. The concentration is higher than that of the cell. So this water will be moving out of the cell. So the cell will decrease. But because glycerol is a penetrating substance, it begins to penetrate it. In other words, it begins to go into the cell like that, and then the concentration is reducing outside the cell. So the concentration inside ends up increasing, and so water will be able to move from outside to the inside. So begins to go inside. Actually, you don't reach a point where the concentration inside becomes too much than outside. You're actually supposed to reach equilibrium. So there will be a point when there will be no change because you have reached equilibrium due to the movement of ions. Yes, please. That's long term. Okay. A 23-year-old Zambian woman is admitted to the emergency department having had two tonic clonic generalized seizures which were witnessed by her mother. Her mother says that her daughter had been behaving increasingly strangely. Investigations, you can see the concentration of the ions, list abnormalities, and what's your diagnosis. Let's look at sodium. Sodium is 186. Is that below the normal or above the normal? Is that below or above? It's below the normal. So what condition is that? Okay, what's the normal concentration of sodium? Anyone? Yeah, around 140 to 145. So is this now below or above? So this is above. So what condition is that? Okay, so what I'll do is I'll allow us to go and just try to master those values. Hypernatremia there, potassium is below there. You can see actually potassium outside. They say also please just go and know, try to know the values. List the abnormalities. So I'm mentioning if it's a hyponatremia, what are the effects of abnormalities on neurons? We talked about the effects of those ions on neurons, right? If you have got hyperkalemia, you know what it is going to do to the neuron, increasing the excitability. Hypercalcemia, you know what it does. Hypocalcemia, hypernatremia. This one, I sent a tutorial yesterday, so I believe people watched and they can answer this question. So you can only write a diagnosis if you've already answered all those on top, listing the abnormalities. One of the problems that will affect either because they are mentioning about nerves, one of those problems which affect nerves should be the what? The myasthenia gravis and those others should be one of them. After you've identified the changes in, after you identify the conditions, is it hyper, and such. Okay, if you try to know those values, I can send the full answer to that question there. 107 milligrams of mannitol is injected into a 70 kg man. The plasma level of mannitol after mixing is 2 times 10 power negative 2 milligrams per mil. If 7 mils have been metabolized during this period, calculate the volume of distribution. Which body fluid compartment is being measured? Is mannitol an ideal indicator for measuring fluid compartment? Reason. So I had sent a tutorial. I hope people watched, but we can answer this one in case 107 milligrams of mannitol is injected. How do you calculate the volume when you are using this? You are using the concentration of the compound being injected. Volume is given by concentration injected, I mean amount injected. So 107 was injected minus amount excreted, 7 grams was excreted or metabolized, divided by the concentration of that compound. And this is 0.02, 2 times 10 power negative 2. This is going to give us what? 100 divided by 0.02. 0.02, I can multiply it by 1, 2, by 100. Also on top, I can multiply by 100. so that this will end up 2 over 100, and that is going to be like a 50. And this answer is going to be in mils. Now, what body fluid does monitor measure? ICF, ECF, interstitium, or the transcellular fluid? Yeah, it does measure ECF. Okay, calculate the volume of distribution. So this is the volume. Huh? Which body fluid is being measured? ECF. Is monitor an ideal indicator for measuring fluid compartment? Reason. Anyone who can answer this one? Is it an ideal indicator? So monitor is, okay, it's an ideal indicator because it actually does not enter the cells. That is why it is ideal for measuring ECF. Okay, the questions are a lot which are included here. So what I'll do is let me just send you these questions. You try them because we've discussed everything. Those I think it will be much help like that. Those we'll see those which you cannot answer, then we can answer together.